gender is a spectrum, and you have a lot of patients who identify as non-binary or genderqueer or something else on the spectrum. So it's not as simple as not wanting to fully masculinize somebody or feminize them with the medications that they're on, but reaching them in being able to affirm their identity without having a dramatic impact on that.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, what's on your mind for discussion today?
Well, one of the topics that keeps coming up is how we deal with people who are maybe different than us. And it's a common topic in medicine. I mean, we do this all the time, right? I remember when I was training, we learned how to examine private areas of the other sex, right? For example, or even your own sex. It sometimes can be tricky. Or how to deliver bad news, or how to handle patients who don't speak your language. And there's all these competencies that we need to acquire. One that is really important and is certainly something that we see a lot, in the news and definitely in the treatment room, is the issue of transgender people who come to our practice with skin complaints. And so we thought it would be a great idea to discuss this and maybe bring someone who does it more routinely. What do you say?
I say it's a great idea. In general, I've been running other conferences as well, besides the IDS being, of course, no bias, the best. But, I think transgender medicine in general is an area where we don't get much training in residency. And so we have an expert with us, Dr. Brian Ginsberg, who is a New York City-based dermatologist, and he has expertise in transgender medicine. And he's published widely on a variety of topics, but today we're really excited to talk to you about this one topic. And thanks for joining us on the podcast, Brian.
Yeah, thanks for having me.
Yeah, Brian, so let's dive right into it. So when we see a patient in front of us who identifies as transgender, how is that different? How should we approach the patient in a way that you think is different, or what do we need to do that we're missing?
The most important thing in that interaction is to make sure that that patient is comfortable. Because you may not know everything and you may need to learn things and ask important questions, but you also have to make sure that that person feels heard and feels like they can be themselves in your chair. You want to be able to ask them questions that are appropriate, not just because you're curious, but because you're actually there to help, and they'll pick up on that.
I think that's so important. And what I hear you saying is try to treat this person in front of you like you would any other patient. And there may be things that you don't understand, and it's okay to ask, and try to be to the point and maybe practical about it so they realize you're not just asking because you are curious. I mean, I can tell you from my standpoint, one anecdote that relates to a common thing in my practice. When I first started treating people with HS, we had a lot of discussion about bras, for example. And I was very uncomfortable asking women, what kind of bra do you wear? How do you have wires? Because I read in the literature and it kind of made sense to me. And so that's just one example where you kind of get comfortable. And I had patients who actually helped me. And I find that every now and then I do see transgender patients and I learn actually about certain things I have no idea about. And so I find in my practice, it's always great to be open to ask questions in a direct way. Like you mentioned, try to get the information that will help you make them feel better. And I think they appreciate that. And then by the way of doing that, I actually learn quite a bit.
Exactly. I mean, it's important to say you want to treat your transgender patients like any other patients, but at the same time you don't, because you have to recognize that they have different backgrounds and different experiences, both in life and especially in terms of healthcare. Also recognizing that they are coming in with a little bit of history, and we don't want to just shrug that off either. So it's playing that balance of, yes, they're just like anybody else, but at the same time, they may have some unique needs as well.
So Brian, one of the challenges, I think, anytime you're entering into an arena where you don't get much training, say in residency, or it's not a familiar area, set that aside. If you already have experience with this in your personal life, or if you have experience with this in your friend circles, I think it's a whole different ballgame. But I think it becomes a little intimidating. So let me just ask the elephant in the room, which is one of the things that we don't want to do is to offend our patients unintentionally. So is that a concern? And how do we ensure that we're making sure that we're not being offensive by accident? Are there certain things that we should just be mindful of and to help release that, sense of discomfort that may be there when it's some new kind of experience for people that they're not familiar with?
Yeah, for sure. I mean, first of all, for people who are tuning into this and staying tuned in, you've already got your foot in the door because you've got the interest and the desire to help. And the good thing is nowadays, there's a lot of things that you could actually go and read and educate yourself. So it's a good idea to get educated, listen to this podcast, listen to some lecture series out there. There are great papers that are published, so you can get that background information. But an important thing to realize is that it's also not just about you in the office, but the entire office experience and your front staff and your assistants. So you want to make sure everybody is on board and educated, so you're not misgendering your patients, using the wrong pronouns, saying the wrong things when you're examining them or asking their history. So you have to make sure that everybody's receptive to that. And if you don't know something, it's okay to ask as long as you're asking appropriately.
And what would be an appropriate way to ask?
So it depends what the context is. If you want to know somebody's pronouns, you could say something as simple as, what are your preferred pronouns? Or do you have any preferred pronouns? If you don't know something that a person says, so for example, if your patient says, yeah, I just had top surgery last week, and you didn't know that top surgery is creating a more masculine or feminine chest, then you can say, oh, I'm sorry, can you explain to me what top surgery is? Something very simple.
Yeah, and your point, Brian, about setting yourself up for success is true in everything we do. And in that sense, I feel one of the things that I try to do a lot of times is we have in our EMR the entire demographics of the patient, and there is a distinction between a biological sex and gender. And so I try to look for that as when I go into the room to make sure if there's something that is standing out. If, as people define themselves based on their gender identity, I try to make sure that I'm respectful of that when I walk in the room. So that's just one tip on how you set up yourself for success by doing that.
For sure. And EMRs have a lot, depending on the EMR, they have a lot of things that you can do. Almost more important than that is also listing their preferred names, because a lot of times a patient's legal name is not the same as their preferred name, because the last thing you want to do is get someone's name wrong before they even end up in the room. All these things need to be kind of cross-checked in your EMR.
And so let's talk a little bit about some medical care, because I think there are some medical issues that come up. You already mentioned some surgical procedures. What are the medical issues that transgender patients experience routinely and come into play in our clinics?
So in general, at least speaking as a dermatologist, a lot of the things that I'm finding are related to hormones. So hormones have a lot of effects on the hair and the skin and the nails, and we see that readily in these patients. So by far the most common thing that walks into my office is acne as a result of being on testosterone. So that's probably the most common thing. Estrogens have a little less effect negatively on the skin. A lot of people say they love the glow of their skin on estrogens, but it can dry you out, and we can see that as well. Hormones also can have a big impact on hair and hair loss. So that's another thing that we manage frequently.
So you gave us the example of a patient who's transitioning or already transitioned and is on testosterone therapy presenting with acne. How do you approach such patient, and is that any different than the usual acne therapy that you would consider?
So it actually depends. It depends on the severity of their acne, and it depends on where in the course of treatment they are in their testosterone. The thing about testosterone is that the acne from it can actually peak very quickly. And I find that on these patients, you have to be pretty aggressive sometimes, or else the scarring can be pretty bad. The treatments are the same as in cisgender patients. I just find that you need to be a little bit more aggressive sometimes. The biggest hurdle really when you're dealing with our trans men, by the way, are individuals who were assigned female at birth but now identify as men, is registering them for things like iPledge, because you start having to worry about teratogenicity and the ability to get pregnant and the regulations that we need to abide by.
So you bring up a great point, Brian, because obviously isotretinoin is something that we'd go for. If someone's on testosterone and they're having a pretty bad breakout, is that a situation where, say, you might start prednisone along with the isotretinoin, just from a medical standpoint, before we go to the beauty of what is known as iPledge?
I could tell you in my experience, I've never once had to start anybody on prednisone. I've always felt okay just starting them directly on isotretinoin and never had an issue with that.
Do they ever blow out with acne fulminans, or is that a concern if they already have bad acne?
It is a concern. It's been reported, but I don't really see it. So I would treat it the same way as I would treat anybody. I mean, the majority of my patients, my trans patients with bad acne, don't have severe nodular cystic acne by the time they get to me, and I'm not too worried about it. If they do have a very severe case, maybe I'll put them on an ultra low dose prednisone, but that's the rare individual.
I see. Going back to iPledge, how do you handle that scenario? Because if they're a trans man and they still have the ability to get pregnant, they'll still need to register for iPledge, right? According to the regulations, and do the pregnancy tests.
Exactly. So until like last year, iPledge was gendered. They had to register, these men had to register as females of reproductive potential, which was horrible. And we had to have conversations with our trans male patients that they had to register as female, which you could imagine was a huge barrier to care and can really exacerbate gender dysphoria. Now it's a little bit better because we have to just register them of, individuals of childbearing potential, because even patients on testosterone, if they have a uterus and they have ovaries, then they are still able to get pregnant. So we do have to register them as individuals of childbearing potential and have them get pregnancy tests. You just have to have an honest conversation with them about the language that iPledge is using, that it's still quite gendered actually when you get down to it, and that it's really terrible, but we still feel like it's the best medication for them and we encourage them to do it. And we try to do supportive things, like if they just need to get a pregnancy test, we offer them to get a serum instead of a urine, so they don't have to have the stigma of having to pee in a cup at a doctor's office. They could just include it with their other routine labs and things like that to make it a little bit easier on them.
Let me ask you about the hormonal changes that come, especially in light of acne. So how do you use spironolactone amongst either a trans woman or a trans man population? And would it actually inhibit some of the hormones that they're using to go through a change?
So it's a great question. And absolutely, it would definitely inhibit any masculinization. So you do have to be careful. I never use it in trans men for that reason. In trans women, you can absolutely use spironolactone. Many of them are already on spironolactone anyway, just as an androgen blocker as part of their transitioning. So sometimes you can talk to their endocrinologist or whoever is prescribing them their spironolactone and potentially increase the dose to get it on something that's a little bit better for their acne. And then an important thing to think about is that you're not only dealing with trans men and trans women, right? Gender is a spectrum, and you have a lot of patients who identify as non-binary or genderqueer or something else on the spectrum. So it's not as simple as not wanting to fully masculinize somebody or feminize them with the medications that they're on, but reaching them in being able to affirm their identity without having a dramatic impact on that. So that's also a conversation you need to be able to have.
I appreciate you navigating us through some of these areas where, these questions do come up. Now, I wanted to turn my attention to laser hair reduction because, we get a lot of requests for that. And how do you approach it if someone has really light hair, like maybe like blonde hair? And does that become an issue for laser hair reduction? And how do you approach hair removal in that scenario?
So, if someone who is not a candidate for laser hair removal, I ultimately end up sending them for electrolysis. I happen to know an electrolyst in the city here who is very competent with trans patients. So I feel comfortable making that referral. If I can't do it, I can't do it. The other thing is, and this is rarely, people rarely take me up on this, but there is a topical of fluorinethine, which is a cream that you can use. Vanica is the brand. I know this is non-CME, so I'm allowed to say that.
Absolutely. Do you find that it's useful?
It's okay. Some people like it. Some people just find it a real pain in the neck to get, frankly. A bunch of people report getting acne on it, so it's like, is the trade-off really worth it? It could be a little bit of a hurdle. If it was easy to get and reliable, I would go for it all the time. I just don't find people have interest in it.
So, Brian, I wanted to go back for a minute because I think as our discussion is going on, I'm realizing that perhaps people listening to us, and you alluded to that in the beginning, maybe are wondering, how do I acquire this? Because obviously, in a short podcast, you cannot acquire full competency, let alone the medical knowledge. And I was wondering, what was your path to becoming more competent and kind of mastering the medical treatment? Are there any particular resources, or was there one patient that kind of got you started on this? How did you make that leap forward?
It was interesting because it all started for me in my residency. And when I was a resident, there was really nothing in the literature. There's like a commentary here and there, but there wasn't really much out there. And I decided to publish a paper on the needs of the trans community with regard to dermatology, and it created this niche for me. And I started collaborating with other people, and we started putting papers together. And this, over the course of several years, just the research exploded. And nowadays, it's a lot easier for people. The JAD has a 2-part CME on dermatology for sexual and gender minorities. And there's several online resources and lecture series. And I've spoken at many academy meetings and other society meetings. So the resources are definitely more out there. You just need to find them. And frankly, you could even look things up on a case-by-case basis, because if you have something in your office, as long as you're comfortable with the patient, say, look, I really want to take care of you. You let me look into this a little bit more, and I'll get back to you. And I think your patients will appreciate that. It's not like everybody lives in New York City where they could just go down the block and find their trans-friendly dermatologist. So if they show that you're actually interested in care, you can say, hey, you know what, let me get back to you. I'm sure there's more out there.
You brought up something that I think is a very interesting point. And here in Learn Skin and on the podcast, we talk about this from the perspective of integrative medicine, which is that it's not talked about a lot in residencies. And I think you pointed this out too, is that, there weren't even that many publications. As soon as you publish one, you become the world's expert, Brian. That's what happened. And then you really nailed it in with a few more publications, I think. But do you think that this has now shifted in residency training? Are there more lectures that are becoming commonplace around sexual minorities or trans health?
It's becoming more commonplace. It isn't commonplace, but it's definitely becoming more commonplace. You look at my colleagues who are in many different academic institutions, a lot of them have integrated courses into their own home institutions. So that has dramatically expanded access. There's chapters being put into major textbooks, so that's also getting better access. The biggest problem really is the hands-on access. So there's not that many LGBT clinics or transgender clinics throughout the country. There's not so many transgender patients who are showing up to residency sessions. So that's really been a hurdle in terms of education. And, a recent survey came out about people feeling if they're competent doing minimally invasive aesthetic procedures on trans patients. And the biggest thing was that they said they just didn't, frankly, have the exposure. So I think that's the bigger hurdle than the resources at this point.
So, Brian, I wanted to ask you, because you've been publishing in this sphere, what do you see as the biggest gap in knowledge and research right now that can help us move forward in the field?
That's a great question. I still think there's so much to learn about everything. I think really what it comes down to is being able to have clear algorithms for care. I think we have a lot of great anecdotal reports and a lot of things that we feel good about, but we're just missing those large scale studies that show, okay, this is safe. This is what you do in this order. Everything is just still too small.
Well, you heard it here. If you want to be the next Brian Ginsberg, there you go. Run a large study. I think it's very important to identify these gaps. So thank you for doing that.
Yeah, of course.
Now, Brian, what are the topics that you end up lecturing on? Or what are the questions that you get asked that you think we haven't had a chance to explore with you here today?
A big component of what I talk about that we didn't really chat too much about is about the aesthetic care for trans patients and what we can do just in terms of daily skincare and minimally invasive procedures.
That would be fantastic because you had touched upon that on your previous comment. And I wanted to ask, what is special, or are there any special considerations that you take in approaching aesthetics that maybe the general dermatologist that's untrained wouldn't do? What are some of the differences that you have in the way you approach?
Sure. So first, it's the most important thing is understanding what the patient desires and not assuming what the patient desires. So you don't want to say, okay, we need to make this person as feminine as possible or as masculine as possible. We don't want to just say, oh, this person is just looking to look younger. We want to know, what do they want? So if they're asking about skincare, do they want to have a skincare that makes them feel more inclusive? Like, I work with this great company called NYC, which is a skincare company that's directly targeting transgender individuals, and it can really make them feel inclusive, and they make great products for people based on where they are in their transitioning. When you're talking about cosmetic planning in terms of doing minimally invasive procedures, you want to ask, okay, well, is there something about you that you wish was a little bit more aligned with your gender? And a lot of times I say, yeah, you know what? I kind of wish my lips were a little bit bigger, or I wish my face was a little bit more contoured. And then you could help guide them into what that actually means and how to achieve those goals.
Thanks for taking us through that. Now, what do you think would be, if you're talking to residents right now and you wanted to talk about, say, a case that everybody should become familiar with? I mean, what kind of cases, because this comes up all the time, like when we're talking about, say, acne, or if we're talking about psoriasis. In dermatology, which cases do you think dominate the most in terms of either aesthetics or either medical? What are the typical things that one should get familiar with?
In terms of medical, by far the most common things in my office, at least, are acne, hair loss, and post-surgical management, pre and post-surgical management. So preoperative hair removal, post-operative scar treatments. Those are by far the most common things in my office. And then aesthetically, the most common aesthetic procedures are facial feminization in my office by far, but also, masculinization as well.
That's super interesting, Brian. So what are some of the procedures that you end up doing for facial feminization?
So facial feminization is essentially the use of toxin and fillers in order to change the shape of a face or enhance certain features of the face. So we know that there are very clear differences between a more masculine and a feminine face. So for example, we can augment the cheeks or give a more pointed chin. We could give the illusion of a more open eye or a flatter forehead with toxin. Of course, we can give some nice bigger lips with some fillers as well. I find a lot of it comes down to cheek contour. You could really masculinize a nice jawline with some good fillers, or widen a chin can make a really big difference. Even something like masseter injections with neurotoxin can make a huge difference in the shape of a face.
Oh yeah, to take away the hard angle, right? It would round it out a bit.
Just soften that face and turn it from a square to a heart. It's a dramatic change.
Listen, Brian, this has been awesome. Love listening to you talk about this. I think we could talk for days and days. I think what we need to do, Hadar, is we need to get Brian to come out to symposia. We need to go visit some of his lectures. For any of you out there that's listening, check out these resources that Brian has mentioned. And then, Brian, do you have a personal website that people can find you at? Because you have a private practice, it'd be great to know where people can find you if they're interested.
Yeah, my private practice it's called Chelsea Skin and Laser. So you could always go to chelseaskincenter.com and get in touch with me or my office that way.
Wow. Well, Brian, thank you so much for taking us through all this. I think we covered quite a bit for such a short podcast, and definitely you left us knowing more, but wanting to know even more than that. So thank you for your time.
Thank you for having me.
Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the fifth annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. I mean, where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. You know, use our discount code POD25 at checkout for 25% off.